Okay, we're going to go ahead and get started. This is a recording of chapter 6 in your Rollins book. It is entitled Desensitizing Medical Materials. And it is a rather short lecture, but one of my favorites. And everyone will be marked here for today. This lecture will precede the midterm, I believe. Okay. So first off, why do we want to desensitize medical materials? Number one, they're pretty mysterious to young children who have never been in the hospital before. Another reason, unpredictable or pain-related procedures can be associated with negative emotional and psychological effects or implications. When children don't understand what is happening, anything in the environment can be frightening. The people, the procedures, the equipment, and on and on. Activities that involve medical play and handling medical materials help demystify those medical items and promote conversation about those items. And the more children handle medical materials and ask questions, the more comfortable they get. So the impact of medical procedures can be explained in this way. There are procedures that can promote distress. And a child's distress during these procedures is strongly influenced by adult behaviors. So if a parent is uncomfortable or doesn't know what to expect or is looking away or turning away or tearful, the child is going to mimic all of those same behaviors. Parental facial expression, their tone of voice, and the verbal content in that conversation can convey either fear or reassurance, depending on, again, the comfort level of the parent and their understanding of the procedure. This is part of the most important job that a child life specialist has, explaining the sequence of events for a procedure or a surgery to both the parent and the child. If we put the parent at ease, the child picks that up. If we put the child at ease, the parent feels better about it. When we reassure parents, combined with distraction during the actual preparation, procedure, then it promotes increased coping for that child. And that's really what it's all about. We want the child to cope well by giving them coping coaching, coping ideas. You could hold someone's hand, you can look away, you can say, ouch, ouch, ouch. You can close your eyes, you can cry. If we coach children and they have really good coping during a procedure, then it contributes to mastery over that healthcare event. There are procedures that occurred on an ambulatory basis, and that's when patients come into the hospital, they're scheduled for a surgery, they're scheduled for an x-ray, they're scheduled to have a blood test, things like that, where ambulatory means walking. So they walk into the hospital, they have these procedures, and it kind of sets the tone, sometimes as a first impression of the medical environment. So some of the common procedures that occur in an ambulatory setting are like immunizations, coming into the hospital for same-day chemotherapy, chemical therapy, where they would go to an infusion center, get comfortable in a recliner chair. They would receive chemical therapy, or what is called chemotherapy, maybe have an MRI or a CAT scan, have sutures if they have a cut or a minor procedure of some sort that requires sedation, and then they go home that same day. Those are often preceded by anxiety, fear, stress about coming to the hospital because they don't know what to expect. Child life has not had prior communication or rapport building with those patients, and we have to kind of, in the moment, prepare them for what to expect and explain and distract and support. Procedures, common procedures during hospitalization for infants, by and large, would be circumcision, vaccinations, vision, and hearing. For younger children or older children, beyond being an infant, at ages 1 to 17, the most common procedure is appendicitis, or what is called an appendectomy. An ectomy is the postfix, or there's a prefix and a suffix. Ectomy means extraction of, or to cut out, to eliminate. And appy is your appendix, so it's a elimination of the appendix. So appendectomy means that you remove the appendix. Additional procedures center around teenage pregnancies, obstetric lacerations, in teen deliveries, chemotherapy, things like that, blood transfusions, when excessive blood has been lost from a car accident or a surgical intervention, something to that effect. I want you to pay close attention because this is a question on the midterm. Procedures involving needles are among the most feared by children. So procedures involving needles create the most amount of fear in children. That's documented in your book. Once fears become persistent or excessive or even unreasonable, it becomes a phobia, according to the American Psychiatric Association. Needle phobia affects 3.5% to 10% of the population, with the median age of onset is 5.5 years. So what happens at 5.5 years? Children are usually getting ready for kindergarten, and to get ready in a public school system, you have to see a doctor to make sure that all of your immunizations are up to date. So it makes sense that needle phobia occurs when children are getting ready for the onset of public school. There can be somatic responses that occur when a needle is involved. It can raise your heart rate. You can have palpitations, rapid heart rate, rise in blood pressure, tremor, feeling faint or actually fainting. You can develop some nausea or excessive sweating and a feeling of panic. So there are definitely somatic responses associated with needle phobia and excessive fear. An individual with needle phobia, needle fear, and avoidance may interfere with healthcare, occupational, academic, and social activities. when procedures have to be canceled because the patient is so distraught over what is going to happen, that it creates a lot of wasted time, energy, expense, and so forth. So what do we do to combat some of these fears and get children comfortable with art? And I mean, not art, but medical materials. So the more that children handle medical materials, the more comfortable they do become. So let's talk about medical art. To desensitize medical materials and the fear that they can produce, children handle medical materials and they incorporate them into their art projects. When you desensitize medical materials, it can help children view feared objects in a non-threatening way. And activities that allow children to handle, manipulate medical objects helps to build greater understanding and confidence in what is going to happen, while minimizing their reaction to that object. Medical play is how we familiarize children to medical materials, whether we use real or Fisher-Price medical materials, to provide a fundamental therapeutic benefit, allowing children to participate in role reversal, changing roles from being passive to active. Let me explain that. When a child is in the hospital, they can often feel like a human pincushion if a phlebotomist comes into the room several times to have to draw their blood, or to poke them, or if a nurse has to start an IV and is unsuccessful the first couple of pokes to get that IV inserted into a vein. So children are fairly passive at that point, just taking on all of that pain and being subjective to a passive role in experiencing a medical procedure. So when you provide these medical materials for children to handle and manipulate, they can have a role reversal where they become the nurse or doctor, and then they are using a syringe, mind you, without the needle in it, on a doll or stuffed animal in a very active role change. So medical art play can provide an opportunity for a child to gain a sense of control over their reality. So there are 4 types of therapeutic medical art play. Medical play includes these 4 basic types, according to McHugh in your book. There's role rehearsal, role reversal, like I just explained, where children take on the role of the healthcare professional and they use a doll or a stuffed animal or another patient or a parent or the child life specialist as the patient, okay? And medical fantasy play being the second type. These medical themes are represented in role play and fantasy play. So children create a fanciful scenario where, okay, you're going to be the baby and you're sick, so you need to say wah wah wah, and I'm going to put a band-aid here. So it's fanciful play in a more dramatic form. And then there's another type, a third type, is indirect medical play, where children use medical materials in a non-medical way in their play. They might use tongue depressors to dip into the glue or the paint, and then they use the paint or the glue on the end of the tongue depressor to manipulate an activity that they're doing or to paint with. They may use a syringe without the needle in it. These are called oral syringes. We fill them with paint, and then they shoot the paint at paper on the wall, and it creates a mural. And then there's medically related art, where children engage in art activities to express their understanding of the medical experience. So, and handling medical materials, creating a collage with like medicine cups and Band-Aids and tape and tongue depressors and syringes, and they can create a tower, or they can create like a 3D collage with these materials. It gets them talking about when they had to have a poke, or when they thought they were going to be choking because the doctor depressed their tongue with the tongue depressor and they started to cough or gag. Research indicates that children who have higher anxiety levels have less understanding or knowledge about medical equipment and procedures. Makes perfect sense. The less a child has been talked to or explained about their procedure, they're going to have heightened anxiety. Makes complete sense. Some special considerations. In your book, Bolig, Fernie, and Klein believe that unstructured play without adult guidance offers the greatest opportunities for children to gain skills and achieve mastery. This could be highly debated by Child Life. We like to supervise when we put medical materials out so that children do know they have a better understanding, they know what materials are used for, and we can clarify any misconceptions about how they're using medical materials. The level of involvement and control of an adult should be carefully considered when conducting medical play. We want children to just be engaged and enveloped by medical materials for their medical play by just overseeing as a facilitator, adult facilitator with children. We don't want to interrupt what they're doing, but we do want to clarify with them that, wow, I really like the way that you are holding your patient really still without any wiggles while they're getting that Band-Aid or whatever. Children should also be encouraged but never forced to handle medical materials that could just feed their anxiety by forcing them. And simple medical materials should be introduced first, like cotton balls and Band-Aids and medicine cups and those oral syringes, those syringes without the needle attachment. So the activity for this chapter that aligns with this chapter is something that you're all very familiar with. It involves a hospital mask, and this is a child's mask, and it doesn't matter if, actually, I think this is a regular size mask, but with a child's mask, it's just a little bit smaller. If you have a mask available, you're going to take the mask. You can bedazzle it or decorate it or draw on it or whatever, and then it becomes like a parachute. So you want to put something very lightweight on the end. You can either use a large paper clip, or this is a really teeny tiny clothespin. And mine usually doesn't fly very well, but you can also see that I decorated the, let's see, I don't know if you can see it. I decorated the little clothespin. It looks like a little person. And then you want to toss this up in the air and see if it flies down. It's actually a little too heavy with the paper clip. I mean, the clothespin. So I'm going to try this. And luckily you don't, all you have to do is just take a picture that you made the parachute jumper. Let me see if this will work. Well, it's better, much better. All right, so that's the activity for today. And this lecture precedes, like I said, the midterm. Remember that by stroke of midnight, you need to turn in a sample of one activity completed, a picture of it, and the write-up, okay? So best of luck on the midterm, and I will see you the week after the midterm.